Hello, my name is Nicole Perna, and I'm a registered dietitian. I've been a registered dietitian since 2001, and as you can imagine, I've seen a lot of different types of weight loss fad diets through the years. Today, I'd like to speak to you about one of them, the HCG diet. The reason I chose to make this video about the HCG diet is because it's a widely used diet that's been advertised as a weight loss agent. It also has a lot of physician backing, and it is highly controversial. So what I'm going to do is first talk to you about what HCG is. Then we'll talk a little bit about the history in terms of it being used as a weight loss agent. Then we'll talk a little bit just briefly about the different types of products that are on the market. We'll review some of the scientific evidence or lack thereof. And then we're going to talk about the FDA and the FTC position on HCG. HCG means human chorionic gonadotropin. This is a hormone that is produced during pregnancy. It is produced by the placenta and it peaks at about 10 weeks. Through the remainder of the pregnancy, there's a steady decline in HCG. HCG is excreted in the urine of pregnant women. This is how it's manufactured into the drug that is utilized in the injectable form. It is approved scientifically and by the FDA and the Federal Trade Commission to be used as an injectable treatment for women who have infertility issues and as an injectable treatment for young boys in particular with specific hormonal disorders. It's also clinically validated to be used as a diagnostic tool to confirm pregnancy. HCG first came out and was utilized as a weight loss agent in the 1950s by Dr. Albert T. Simons. He first observed weight loss in the young boys that he was treating for a hormonal disorder with the injections of HCG. As a result, Dr. Simons continued to treat people and patients in his clinic, in particular women, with HCG injections in conjunction with a very low-calorie diet. The observations that he witnessed as a result of these therapies were what he utilized to determine and develop what is now known as the Dr. Simons protocol for HCG as a weight loss agent. None of the observations that Dr. Simons saw in his clinic have ever been substantially proven by a clinical or placebo-controlled trial to date. In fact, in 1977, there was a trial that actually disproved his theories, and we'll talk about that a little bit later. HCG, the claims that have been made about HCG as a weight loss agent and that Dr. Simons observed in his clinic were the following. Number one, he observed that it can be used as an appetite suppressant that would allow his patients to tolerate the very low-calorie diet that they would have to stay on. Number two, he claimed that it would mobilize these abnormal fat stores that are normally not able to be mobilized in the body so that it can be utilized as fuel. And number three, he also witnessed and claimed that it would redistribute fat to other areas of the body, which would help with weight loss as well. Now that I've shared with you some background information about HCG, let me tell you a little bit about the diet. The diet was originally developed by Dr. Albert T. Simons in the 1950s. So there's an original Simons protocol that we'll talk about, and there's also adaptations that have been made over the years. A typical treatment period of the HCG diet is anywhere from 3.5 to 6 weeks depending on the desired weight loss. There are two phases of the diet. The first phase consists of 2 days. Within the 2-day period, the dieter is encouraged to consume as much as they can of whatever foods they want. The purpose, it's basically called the loading phase. The purpose of the diet, the loading phase I should say, is to prepare the dieter for the second phase of the diet. The second phase, which starts on day 3 through the remainder of the treatment period, consists of an extremely low-calorie diet that is in conjunction with daily HCG injections, which would be the original Simons protocol. There have been adaptations with other non-injectable products, which we'll talk about later. It also includes no exercise. with the exception of some adaptations that they've made that allow minimal exercise. But a typical HCG diet treatment plan would not allow exercise at all. The typical caloric allotment for a person who's on the HCG diet is 500 with the original Simon's protocol to about 800 calories a day with the adaptations. It is a fat-free diet that is very limited with specific food groups. A person who is participating in the HCG very low calorie phase diet would be allowed 2 fruits and 2 vegetables every day. Those fruits and vegetables come from a very small list of approved fruits and vegetables. They would be allowed approximately one serving of a carbohydrate per day, and the remainder of their 500 to 800 calories would come from protein. The adaptations, including the Simon's protocol, are very carbohydrate restrictive. So there's not a lot of carbohydrates allowed on this diet. Once a dieter has completed the treatment phase of the diet, then they would move into what's considered the maintenance phase. This phase of the diet lasts for 3 weeks. During the maintenance phase, the diet is liberalized with the exception of starch and sugar. A dieter is expected to weigh themselves every morning, and if there's a weight gain that exceeds a 2-pound maximum, then the recommendation is to skip both breakfast and lunch and consume a large steak with either an apple, a small apple, or a large slice of tomato and plenty of water for dinner. According to Dr. Simon's and his protocol, failure to do this will result in the need for strict dieting. Once a dieter makes it through the 3-week maintenance phase, then they would be allowed to slowly include starches and carbohydrates back into the diet in accordance with their morning weight. So it would be very limited depending on the weight gain they experience in the morning. If they experience weight gain, they revert back to the previous recommendation of skipping breakfast and lunch and consuming the high protein dinner. Next, I'm going to interview 2 experts in the field of health and wellness. Dr. Lesbron is going to be talking to us about fat mobilization and what is required for the body to mobilize and burn fat as energy. And Dr. Gazer is going to be speaking to us about macronutrients, in particular carbohydrate, and exercise and a healthy lifestyle. Then I will return and discuss the remainder of the information with you on the HCG diet. Thank you. Good afternoon, Dr. Lesbron. How are you today?
Good. How are you, Nicole?
Thank you for sitting down with us and allowing me to interview you regarding one of the popular fad diets out there, the HCG diet. Would you mind giving us a little bit of information about your background before we get started?
Not at all. I'm Dr. Christy Lesbron. I teach at Arizona State University. I teach classes in macronutrient metabolism, also food science. So my background, my PhD is in physical activity, nutrition, and wellness, where I actually looked at different ways that you could possibly change fat metabolism using different types of supplements. So my doctoral dissertation focused on that. So I looked at fat oxidation when people are at rest, during exercise, so I know a little bit about how fat is used in the body.
Just a little bit.
Just a little bit.
Well, having said that, one of the popular claims about the HCG hormone and the HCG diet is that it promotes mobilization of fat. So can you give us a brief description of what that process looks like in the human body?
Sure, absolutely. So in order to get fat out of the fat cell, you have to do something called lipolysis, which is the mobilization of that fat. And so it all starts when a hormone like glucagon or epinephrine, for example, binds to the beta-adrenergic receptor of the fat cell, and that stimulates a cascade of reactions that results in the breaking apart of the triglycerides in the fat cell and then the release of those free fatty acids into the blood. And so unless you stimulate that beta-adrenergic receptor on the fat cell, the fat never gets mobilized.
Excellent. So, now that we have a little bit of an understanding of how the fat gets into the blood, we know that a certain hormone profile has to exist in order for that to happen. What's the process of fat getting stored?
So in order to store fat, basically, it's mostly dietary fat that gets stored. So that fat gets carried in the blood on either a chylomicron or a VLDL, these particles are called. And so lipoprotein lipase is what pulls the fat kind of out of the blood and then brings it into the fat cell to be stored. So all fat is stored by the same process. It doesn't matter whether you weigh 100 pounds or 200 pounds. It's the same physiology that results in the storing of fat.
To your knowledge, is there any is there any reason why certain fat would be stored differently than others? You said it was mostly dietary.
Yeah, mostly diet. So your body very rarely will take carbs and convert that to fat. It's just not very metabolically efficient to do that. So when you overconsume calories, from carbohydrates or protein or alcohol, those calories get burned, and then any dietary fat you consume just gets stored.
Okay.
So it's kind of how the process works. And with the reverse, fat mobilization, you have to have elevations in glucagon, which comes from fasting or lowering your calorie intake, or elevations in epinephrine from exercise in order to stimulate that process of fat breakdown. So the laws are kind of the same for everyone.
Okay.
That's how it works biochemically.
Thank you very much for that. To your knowledge, based on any of the research that's been done that you've been able to see, since you have done quite a bit of research on mobilization of fat, is there anything out there that shows a benefit to HCG in mobilizing fat?
The research that I've seen has been pretty limited to my knowledge. There's never been a study showing that HCG specifically stimulates the beta adrenergic receptor and promotes fat mobilization or beta oxidation, burning the actual fat. My impression seems to be the fact that you're only consuming 500 calories a day. That will make you mobilize fat because your body has no choice. When you cut your calories that dramatically, you're forced to use some of your endogenous fat stores inside your body for energy.
What would be a few of the concerns, your primary concerns about a 500 or even an 800 calorie a day diet?
When you cut your calories that dramatically, your body kind of goes into a starvation mode, conservation mode, and you become very efficient. And you might think, oh, efficiency, that sounds good, but that means you actually require less calories to survive. You're losing lean body tissue. Your mitochondria become more efficient, so even when you exercise, you're burning less calories than you were before because your body is trying to deal with this very low calorie level, and it becomes more efficient. And the downside to that is when you start to eat even remotely normal, even if you eat 1,300 calories, which is not very much, it'll be really hard to keep weight off because your body adapted to that lower calorie level. Okay. So it's just not good to yo-yo and keep doing that to your body because it really will lower your metabolic rate.
So what do you recommend to all of those Americans out there and pretty much anybody across the world that wants to lose weight?
Everyone in the world, it seems like. I would say focus on activity and healthy eating, and don't make the number on the scale the primary focus. No weight is ever going to be perfect enough to make you happy. When you focus on health at any size, it's going to be a win-win. But that's a challenge to help people learn to love themselves and be healthy and active at any size is what I would say is the best way to go.
Excellent. Well, thank you again for your time today.
Thanks.
And have a wonderful day.
You too, thanks.
Hello, Dr. Gazer. How are you?
I'm pretty good, fine, thank you.
First of all, thank you very much for sitting down with us today and talking to us about this diet. Can you start off by telling us a little bit about your background?
Well, I'm an exercise physiologist. I got my PhD in 1978 from the University of California, Berkeley. I spent a number of years at UCLA before going to the University of Virginia and then coming to Arizona State in 2008. So my primary area of expertise is exercise physiology, but I also do work that is related to the effects of diet and exercise on overall health.
Okay, excellent. And some of the research that you've done focuses on certain macronutrients like carbohydrates. Mm-hmm. And speaking of that, one of the aspects of the HCG diet is it's very low calorie, but it's also a high protein diet. Right. What have you found in your research about carbohydrates in the diet?
Well, any diet that results in a lot of weight loss quickly is due to calorie restriction. So it really doesn't matter much if you restrict carbohydrates, restrict fat, or restrict protein, or emphasize any of those macronutrients. If you have a significant calorie restriction, you're going to lose weight.
So any extreme restrictions probably wouldn't be very realistic.
Well, virtually any kind of restriction is not going to be realistic. And I'm not an advocate of any type of caloric restrictive diet.
Okay. What do you think if somebody chooses to want to do a diet because they want to lose weight quickly and it is a restrictive diet, what are the risks in doing that besides weight gain in the future?
Well, that's the major problem. They will ultimately gain it back. And the research is pretty solid on this. We have been kind of in a diet mentality, our culture, for decades. So this is nothing new. No diet is new. The low-carb diet is not something that's new. The HCG diet is not something that's new. These have been around the block many times. And they all get reissued in various forms. And I have no doubt that low-carb will come back in another 5 or 10 or 20 years, whatever. But it will come back because it will be time for that. We have a diet mentality. And so as people lose weight, they typically will ultimately regain, some very quickly, some more slowly. But there are problems associated with this repeated weight cycling, the losing followed by gaining and over and over again. And the problems are that weight cycling generally results in health outcomes that are very much the same as those associated with obesity, for example. So people who weight cycle are more likely to have blood pressure problems than people who don't. People who are obese tend to have more blood pressure problems than people who are not obese. People who weight cycle tend to have greater health risks than people who don't. Okay. And it may not pop up immediately. It may be something that is more of a chronic condition that might come back to harm the individual decades later.
Okay, interesting. So what can you tell the general public, what recommendations do you have for them for overall health? If they want to choose a diet that's not going to result in weight cycling, and you already mentioned some things earlier about balancing the diet in a plant-based diet, but what are your fine-tuned overall recommendations for us?
Yeah, don't focus on total calories, but try to focus on a few key changes in the diet that an individual thinks might be sustainable. And don't worry about cutting out things so much as adding healthy things. So for example, if you focus on adding fiber-rich whole grains, maybe an extra piece of fruit at lunch or at dinner or something like that as a snack, just focus on making those changes and nothing else. And that way it doesn't require a major overhaul of your diet and way of living and so forth. And those are probably going to be more sustainable. Okay. The same thing with exercise. If you're very sedentary and you think, well, gosh, the federal government says I should be getting in 150 minutes a week of at least moderate intensity activity. How do I do that? That's 2.5 hours, all right? Well, my research shows that you can get in those little exercise bites, if you will, in bouts as short as 5 or 10 minutes. We spend our lives, most Americans spend a good portion of their life with this constant battle with the weight. Okay. And a lot of it is just due to their biology, their genetic makeup. It's not a defect in their moral character or their willpower. Biology controls a lot. We just kind of have to accept that. We just have to accept the things we cannot change, but focus on the things we have within our power to change.
Awesome. Thank you. So it sounds like if I sum up your recommendation in 3 steps, it would be focus on healthy foods, incorporating healthy foods in the diet versus restricting certain foods out of the diet.
Right.
Focus on getting some type of exercise in and not having to do something drastic, something small, few 5-10 minute things throughout the day.
Yeah, short bouts of activity.
And then being realistic.
Yeah, being realistic, and that's probably the most important thing, because every body is different. Literally, every body is different, and it won't respond the same way. If you put 100 people on exactly the same diet, you will have 100 different responses. You put 100 people on exactly the same exercise program, no matter how, the intensity, the duration, the frequency is exactly the same, and you will get 100 different responses in terms of their weight loss or their fat loss or changes in blood pressure or any other kind of health outcome. People respond differently.
Well, it has been a pleasure speaking with you. I've learned a lot, and I'm sure that multiple, our viewers are going to learn a lot as well. Thank you once again.
Sure.
As I stated earlier, there's different forms of HCG available. There's the original injections, and there's also pellets, nasal sprays, and oral drops available. The pellets, nasal sprays, and oral drops are typically available over the counter. They're usually marketed as being either homeopathic or hormone-free. First of all, HCG is not homeopathic. It's not on the list of homeopathic products according to the FDA website. Second of all, if the products are hormone-free, which all over-the-counter products would be because HCG is a pharmaceutical, then that means it doesn't contain HCG. So when you see a product that says hormone-free HCG, it doesn't have HCG. Typically those products contain a proprietary blend of amino acids and other types of herbs in them, but they don't contain HCG. HCG is in fact a pharmaceutical that is regulated by the Federal Drug Administration. It requires a prescription by a physician. That is the only way to obtain true HCG. HCG is not approved by the FDA as a weight loss agent. The reason it's not approved is because it has not been clinically proven to be effective or ethical as a weight loss agent. In fact, there was a study done in 1977 that was a placebo-controlled trial. It was the first one that actually disproved HCG's function as a weight loss agent. In 1995, a meta-analysis was done, and that's when researchers review all of the science up into a given period, or through a given period, and they looked at everything that was available out there on HCG in terms of a weight loss agent, and they concluded that there was no scientific evidence to support HCG in terms of mobilizing fat, in terms of redistributing fat, in terms of suppressing the appetite, or creating a sense of well-being. As a result, promoting or marketing HCG as a weight loss agent is illegal according to the Food and Drug Administration and the FDA. In conclusion, I'm going to state it one more time. There have been no scientific studies or published clinical trials to date that have demonstrated HCG as an effective weight loss agent. Any weight loss that has been experienced as a result of someone participating in the HCG diet has been solely attributed to the very low calorie portion of the diet. There are some serious nutrition implications to that. Remember, Dr. Lesbron discussed the possibility of creating a situation in which your body becomes more efficient. This would set someone up to gain weight at relatively normal calorie intakes that they wouldn't normally gain weight before. Remember what Dr. Gazer mentioned in his interview about the risks and the health consequences of weight cycling, which is what happens when you set yourself up to gain weight at a normal calorie intake. In addition to that, the other things to be concerned about are low blood pressure, low blood sugar, depression, fatigue, constipation, nervous system disorders, and even death on the HCG diet, or on very low calorie diets. As a result, this is the very reason that the Food and Drug Administration does not approve HCG as a weight loss agent, but also discourages the public from participating in the diet at all, because there are some serious things to consider with doing this diet. So what do you do if you want to live a healthy lifestyle and lose weight or just maintain a healthy weight? I'm going to echo the recommendations of Dr. Lesbron and Dr. Gazer because they were head on. Number one, focus on including healthy foods in your diet as opposed to trying to exclude things that have been perceived to be bad or unhealthy foods. Number 2, include physical activity on a regular basis. That means, remember what Dr. Gazer said, you don't have to go out to the gym and spend an hour and a half, 2 hours at the gym killing yourself every day. You can get the health benefits associated with regular physical activity in short bursts from anywhere from 5 to 10 minutes a couple of times a day. So whatever works for you, get the exercise and the physical activity in every day. And probably most importantly, number 3, be realistic. We're not all going to lose weight in the same rate. We're not going to all lose weight from the same areas. We're not all going to have a normal, healthy weight that's what we necessarily want. We have to be realistic. If you're realistic, then you'll be satisfied with your results. You don't have to purchase fancy designer products. You don't have to use HCG injections or go on an extreme, very low calorie diet in order to have a healthy weight and healthy lifestyle. You can do that without those products. If you would like more information about the Food and Drug Administration position on HCG, you can visit their website at www.fda.gov. Thank you for your time, and I hope that you've enjoyed this video. Have a good day.